If you feel like your body has started changing and you're between the ages of 35 and 50, you're probably in perimenopause because most of us are very in tune with how our body feels. And so if you feel like something is going on and something's not right, it's probably not.
So I want to ask you, as a women's health nurse practitioner, what types of issues do you usually see or treat?
Well, as a nurse practitioner in women's health, I mean, I see the full gamut of reproductive concerns. But when it comes to specifically my sex counseling practice, I would say that the biggest complaint I see in my office has been low libido or low desire. That is the most common reason that women come to me for sex counseling in general. The other thing I probably see a lot of is pain with intercourse or pain with penetration of some sort. That's a very common complaint as well. I also, in the last couple of years, have done a lot of menopause management. And so anyone that knows a woman that's been in or close to menopause knows that it affects their sex life. And so that is something that I've been talking a lot to my patients about. So I would say those are the things that I see most often, but there is a full range of sexual dysfunction that I have treated. So
Yeah. And so for anybody who doesn't know, how does menopause affect a woman's sex life or their sex drive? How does that all come together?
of course. And to be quite honest, it's really complicated, which menopause itself is just very complicated. I always try to explain to women that menopause is, and perimenopause. So perimenopause is the phase where women start having symptoms, but they are still having some sort of period, or they still have some estrogen, floating around in their bodies. So perimenopause is when I start seeing most of those complaints, and most women enter perimenopause somewhere between the ages of 40 and 50. And for most women, the age between 40 and 50 is also a super complex time because their children are getting older, their parents are getting older. A lot of women, their careers are changing. And so it's like we're adding this complex, like hormonal dysfunction, craziness, chaos time on top of life that's already chaotic. So I think that, life itself also, plays a big part in this too. So hormones themselves, big changes to estrogen, big changes to testosterone that are happening around this period of time. And that directly can affect a woman's sexual function, but also changes to the vaginal tissue and the vulvar tissue can also affect their function because they can start having pain and dryness with sex. So those are two big reasons. But I honestly find one of the biggest reasons that most of these women are having such a troubling time in the relationships is because of just how life is so chaotic as well. So like I said, it's an unfortunate mix of many different things.
Right. A lot of big changes happening at one time, both
Yeah,
on like the medical side and the social and psychological side. It all creates like the perfect storm.
absolutely.
So if someone's watching this, we have a lot of women who watch our YouTube channel. If somebody's watching and they're like, how do I know if I'm in perimenopause or menopause? Like, are there common symptoms? Do you have to go to a doctor and get a test? What is the deal?
So, so perimenopause, like I said, is just this period of time before your last period.
Mm.
Menopause is not a long-standing time. Menopause itself, this is kind of misunderstood. Menopause itself is when you've not had a period for 12 months.
Mhm.
And that can be a little complicated for people that have certain hormonal devices like IUDs or an implant where they don't get a period regularly.
Yeah.
Excuse me, or if they had a hysterectomy for some reason and they don't have a period anymore. So it can be kind of difficult for those patients to understand, like, where is menopause? But menopause itself is just like that one day where you haven't had a period for 12 years. Otherwise, we're peri, which is before, or we're post, which is after. So perimenopause, common symptoms, I mean, the ones most people know about: hot flashes, night sweats, mood swings. But it actually, there's so much more. We see a lot of anxiety and depression. We see a lot of skin changes, joint muscle pain. There actually can be changes to your hair. Your vision can change. And then sexual function is another common complaint. And so there's not, if we had a test to tell a woman when she went into perimenopause, that would be so amazing, but there just really isn't. And the reason is because, like I said, it's such a chaotic time that your hormones are just doing this like rapidly throughout this whole period of time. So I could test your estrogen one day and it could look normal. I could test it in a week. It could look off the charts. I could test it a week later and it could be like 0. So it's really difficult to diagnose. It's really just based on how patients are feeling. So, it takes a thorough history of our patients to really understand that. And I would say to most women that if you feel like your body has started changing and you're between the ages of 35 and 50, you're probably in perimenopause because most of us are very in tune with how our body feels. And so if you feel like something is going on and something's not right, it's probably not. So.
Yeah, that is so interesting. So it's more about like tracking your symptoms and noting how you're feeling and what's changing versus going to a doctor and getting blood work done or doing some sort of test.
Yeah. Yeah. Like I said, women that don't have periods regularly because of some sort of surgery or hormones that they're on, we can test your estrogen. If we think, you probably have menopause age, like, let's say you're 52, we just want to kind of see where you're at. We can do estrogen and FSH. That's another hormone. We can do those levels like kind of back to back to back a few times just to see if levels are within the menopausal range. But to be totally honest, that's not really helpful, because I'm not going to treat you much different if you're menopausal as opposed to if you're perimenopausal. If we're talking about like making you feel better, we're trying to treat your sexual symptoms. Like, I don't really care where you are. I just want to make you feel better. So.
Yeah, this is so interesting because I think there's so much the general public does not understand about perimenopause, menopause, postmenopause. Up until this moment, I thought menopause was the rest of your life. Like after you didn't have a period, I didn't know it was called postmenopause. So I just learned something new today.
Awesome.
That's amazing. Did you know a lot of people watch our YouTube videos and never subscribe to our channel? Before you finish this video, take a moment to click subscribe.
When I became a sex counselor, I don't think I understood how few sex counselors that are certified in medicine there really are compared to like sex therapists and educators. Like when I was trying to find a supervising counselor, to help me with my hours, it was a little difficult. We need more counselors out there that work in medicine, and I think that we need to be more utilized. I think we need to get the word out that nurse practitioners, counselors that work in medicine are really are a very important part of sexual health care.
Thanks for watching this video with Kelly. I think this was such an amazing topic. If you love sexual health education, please subscribe to our channel. And do us a favor, share this with someone who might benefit from this information, especially information on perimenopause and menopause. This is such a hot topic right now. Your support helps us reach more people with important sexual health information. If you are passionate about this space, we know you'll enjoy these videos, so check them out. Please like our video, and remember, you are exceptional.